Hi, everybody. Thank you so much for joining me this afternoon. My name is Ina, and before I get into my project called Mental Health on the Margins, I kind of just wanted to give you a quick anecdote as to why I chose this topic. So I'm an RA here on campus, a resident assistant, and over the summer, we receive a number of training seminars and workshops that inform us on the resources that exist on campus so that we're better able to support our students, our residents. And during one of these training sessions, there was kind of a moment where myself and the other RAs of color, were looking at each other from across the room because we realized while a number of mental health oriented resources exist at BU, none of them are really catered towards the experience of students of color. And in that moment, I realized that's what I wanted to do my Keystone on. So to move right along, in terms of my methods, I'm a journalism major. I love audio storytelling, so I chose a long-form enterprise-style audio piece to be the medium for my Keystone project, and using description, explanation, and comparison of my interviews to really frame the overall topic. And I interviewed a number of students as well as experts in the field. As for the research questions I chose to address, I was looking at three big things. One, why are Black students in need of culturally competent mental health care resources that are geared towards their experience? Two, what stigmas exist in the Black community surrounding mental health care and why those stigmas exist? And three, the ultimate question, is BU adequately meeting the needs of students of color? And a quick vocabulary note before I move on. You'll see the abbreviation POC a few times throughout this presentation. That just stands for people of color, as well as the fact that the term African American is going to be seen, you're going to see that on a lot of the research figures that are in my presentation. However, I tend to use the term Black American just because African American is often used as kind of an umbrella term, even though not all Black Americans or Black students in this case identify as African American. So I just wanted to make that clarification. Now, to give you some background information on this topic to kind of understand the overall importance and relevance of my Keystone topic, 13% of the US population is African American or Black. And among that relatively small group, 27% of them are living below the poverty line, 11% are not covered by health insurance, and the death rate for Black and African Americans is higher than primarily Caucasians, but also other marginalized groups for a number of issues between heart disease, diabetes, HIV/AIDS, and even homicide. And this doesn't even begin to cover the number of other disparities Black and African Americans face, whether that's higher incarceration rates or even resource adequate access to resources such as education, food, etc. So all of these factors in mind, along with other systemic and historical factors we don't even have time to get into today, African Americans are the marginalized group most likely to experience a number of mental health care issues. And that being said, they're still receiving the poorest quality of care, the least amount of access to culturally competent care. And finally, when African Americans or Black Americans do pursue mental health care resources, only 1 in 3 of them are actually receiving it. So that's kind of the broad overall issue. And when you're looking at Black students in particular, Black American, African American students, that's just a microcausal kind of example of that. So this figure you see here from the STEE Fund is showing that Caucasian students are the most likely to report having mental health issues between anxiety, depression, bipolar disorder, and etc. Now, that's not because Black students aren't depressed or aren't anxious. That's simply because Black students don't feel supported in seeking out those resources. You'll see here on the bottom of the figure, it says African American students are more likely than Caucasian students to say, that they tend to keep their issues to themselves, and that's because of a lack of support, which is pretty much reflected right here by this quote from one of my research participants named Simeon, who says he rarely asks for help as a student at BU. Moving right along, this tends to affect the overall college experience of a lot of Black American students, whether it's feeling overwhelmed or unprepared. Black American students and other marginalized students as well just don't have a great perception of their college environment because of these experiences with mental health. Again, reflected in an interview with one of my participants, Michelle Jaroge, another senior here at BU, who expressed, kind of being shocked and not really prepared for the lack of preparedness she'd feel coming to BU. So clearly the student voices are really the most important when you're talking about an issue that affects Black students. So I'm going to play for you now a quick snippet from Mental Health on the Margins.
There's a whole different perception on asking for help. So it's a lot harder for people of color to access those emotions and be able to advocate for themselves in those avenues.
Maybe it's just like, yeah, we'll give you a white therapist. That'll be all fine and dandy. I'll go on first day. They won't see I'm a black man, and a lot of the trauma that I have is because of the culture that comes with being a black man in America.
I walked in the door at behavioral medicine, and the person screening me was white, and the questions they were asking me didn't feel like they lined up with my experience.
If I have to explain institutionalized racism to you, to explain why what the professor said to me was wrong, is this really therapy, or is this me educating you?
Amina Joseph. This is Mental Health on the Margins.
So that's just a little bit of a tidbit, and clearly, the most compelling voices in this issue, and to me the most important, are the student voices, and that just kind of proves as a great segue into my challenges, one of which the largest challenge for this project being kind of choosing how to hone in on the demographic I wanted to talk about. Being a student of color myself, I obviously wanted to advocate for all marginalized students on this campus, but it's, for one, not only is it not feasible for an audio project that can only be of a certain length, but also the POC experience, the person of color experience, is not monolithic. So I ultimately decided to focus on Black students because that's the community I obviously have the most connection with, but also just have the most experience with and access to. As for my findings, the largest themes that kind of showed up in my interviews and in my research were that, one, BU's first step in order to implement more culturally competent care is just hiring more diverse faculty, having those intersectional lenses to address students with. Secondly, students often feel that the onus for finding solutions is on them, and that just needs to end in order for us to really kind of remove the pressure that students of color feel, namely Black students on campus. And finally, if BU really wants to address this issue, they're gonna need to take a multilateral approach. Mental health care does not just exist within the confines of behavioral medicine or student health. It's also about the kinds of trainings our faculty are receiving, what kinds of syllabi are being structured and how punitive they are, how forgiving they are to students' circumstances, and so forth. So finally, these are findings that I do intend on presenting to a number of entities on campus between the Dean of Students Office and Student Health Services. So I decided the last kind of stretch of my project was to create a website in which I not only placed the project, but some additional takeaways from the piece that I thought were really important, but just couldn't fit in my 10-minute audio piece. So those audio files exist here on the website in a gallery, as well as some resources that not only students can use, but institutions like BU can access in order to better address mental health care in an inclusive way for all of its students. So thank you so much to everybody involved in the project, Kilachand, BU, and everyone who supported me. Thank you.